to go. We are on the agenda, but not high up yet. And definitely not where we should be if you're looking at the real public health impact of this. So this is the timeline again for the global level within public health. And again, it's a very, very recent development. I completely agree with Heine. If you're thinking back to the gymnastics movement, that started more than 1.5 centuries ago. Now, what you might ask, or what I'm going to talk about now a little bit, is there implementation and collaboration? Because I think we are a little bit in the public health agenda, but we're only beginning to actually get it. Now, there are a few organizations that really focus on this specific topic of physical activity and health. And there are many more who have it as one of the topics, and I think the Sports for All organizations are an excellent example of that. You do physical activity promotion for health, but not only for health, definitely. Another example have been the healthy cities as an important movement within health promotion. We've seen the long lists of topics you're concerned with. Physical activity is one. Public health, WHO is the same. WHO has many priorities. Physical activity is only a single one. Sports medicine, another example. Now, if we look at specifically the organizations that focus on physical activity and health, the first one to emerge as it exists now was RAFAPANA. This is the Physical Activity Network of the Americas, actually grew out of South America. Victor Matsuda was very much behind that. Sao Paulo, then South America, then both Americas. The next network that actually emerged, there had been a predecessor, but the current network in its current form, the next one was HEPA Europe. And Winfried Banzer has been talking about that yesterday, so I'm not going to go into any details. We have a somewhat smaller network, and it's been around for a few years as well, for the Asia-Pacific region. And just now, actually only this year, the African Physical Activity Network has been launched. It's coming out of South Africa, for example, in particular, and it's trying to integrate more other countries. They're at an early stage, but they are emerging as well. I hope I can do this later. Okay. And there are some contacts within the Arab countries, but no real network yet. So this is where we're standing globally, and there is also a global physical activity promotion network, which is the Gita Mundo. Grew out of, really, again, South America, Victor Matsuda first, and this is where we're standing now. This is the executive board. We have all the regional networks actually represented within the executive board as it exists now. I'm in there for HEPA Europe, for the European region, but we have all the other networks that are being represented there as well. And we have now also a work program. And if you compare this work program maybe to what you've heard from Winfried Banzer about HEPA Europe yesterday, you can see it's much smaller. I think it is much more important what is actually happening at the regional level, at the continental level. But I agree with what Heine has said, that there is need, and this is our idea, of actually improving the communication between the different partners, both within physical activity and health as such, and also with the partners in a broader sense. There is also another very important international institution in physical activity and health. This is the International Society for Physical Activity and Health, with its different committees, and one of them is Global Advocacy for Physical Activity, GAPA. Now the difference here, and we are working very closely together with them from Agita Mundo, so next year we're going to have the Agita Mundo meeting together with HEPA Europe, the European network, in EDA. NISB is going to be the organizer there. The year after we're going to have it together with the International Society for Physical Activity and Health in Australia. Now ISPA and Agita Mundo work together very much. The difference is ISPA is really a scientific society. It has individual membership and it's run mainly in English. Whereas Agita Mundo is a physical activity promotion network. It has institutional membership and it is multilingual. Up to now it's run in Spanish, Portuguese and English, and we would like to add a few more languages if we succeed in doing so. But obviously we have many other partners that are extremely important in this field. And I'm now going to show you a few of the current products that have come out, and not only out of the physical activity and health organizations, but many of them out of the other organizations as well. And it's these products that will actually help us to make more specific progress on the ground. of all, WHO has brought out a number of publications. This is only one of them on how physical activity can be improved. This is a very important document. It has been launched this year by GAPA, which is the Advocacy Council of the International Society for Physical Activity and Health, the Toronto Charter for Physical Activity. It sketches out how at the national level one should go about promoting physical activity in a very systematic way. Those of you who are familiar with health promotion, a few years ago there has been the Ottawa Charter for Health Promotion, also launched in Canada, and the idea is very much similar to that, providing a common framework mainly from a public health point of view to physical activity promotion. Then there is sports medicine. ACSM, the American College of Sports Medicine, a very important international medical society, has launched the initiative of exercise as medicine, using contacts through physicians for physical activity promotion. So this is something that has come out of a slightly different corner, because traditionally sports medicine is interested in sports traumatology, injuries to sports, treating them, and exercise physiology. But there is more interest now also in physical activity promotion. Then we've had the example of the Healthy Cities Network, Turku. That's a very good and very specific example. This is an example that has been developed within HEPA Europe and also within our unit, together with WHO, Healthy Economic Assessment Tool. This is for traffic planners, transport planners. Then this has been a recent document, a few weeks ago, has been launched in Stuttgart. There is a network, has been a project on European cities promoting physical activity in children in particular, co-financed by the European Commission. And again, another example that you're probably very familiar with, because TAFISA has been involved there. These are the guidelines for sport clubs for health programs. This is only a selection. There are more and more now of these products around that will allow us not only to have declarations, but actually to have real action, to make real progress on the ground. So I think there is a considerable amount of implementation of collaboration already, but I also agree with Heini that there is room for more synergies and more collaborations. Health are what we can contribute to physical activity promotion. You can see this from a document that has also been mentioned a little earlier. The health sector can take on the stewardship role. This was a very concise question and very specific question that Morgan's asked. Who had the lead? And I think this is the question we always have to ask. If we have a collaboration, if we have a network, somebody has to take the lead. The health sector can do that, should do that, does not always do it. I'll come back to that a little later. In addition to that, WHO actually sees 6 additional elements where public health can take an important role. There is making physical activity part of primary prevention, primary care. Documenting effective intervention and disseminating research. I think the Healthy Cities Network is an excellent example of how this can be done. Demonstrating the economic benefit of investing in physical activity, and I think this is particularly important if we're going through a financial crisis. Because then we don't only have to talk to the people who are, as we all are, absolutely convinced and enthusiastic about the possibilities for physical activity promotion, but we have to talk to and we have to convince the other people who don't have the same ideas, who don't have the same experiences as we. There, I think economics are a very important part. The health sector can help to connect with relevant policies. It can do advocacy and change of information, and the health sector obviously should be leading by example as well. Now, what can sports do for physical activity promotion? And now I'm going to go through a number of questions that to all of us here in the room are self-evident. But I'm going to go through them critically, and I think I might be able to provoke you, at least provoke you to think about them a little more. Is being active in sport good for health? That's very simple. Yes. If you look at what Liedeke has quoted yesterday, the current recommendations by WHO, which are basically the same as recommendations by the Americans, it's obvious that we can fulfill these recommendations by doing sports. There is absolutely no question about that. I'm afraid I wasn't here yesterday, but I'm sure that Walter Brain has talked about the possibilities that sports have here in really promoting in promoting health as well. Now, if we go again to HEPA, and this is the concept as we're using it in Switzerland within our national strategy on diet, physical activity and health, we see that sports and HEPA have a large overlap. You can do HEPA without doing sports, no doubt about that. And you can do sports without doing HEPA. For example, if you're doing heavyweight boxing against the Klitschko brothers. But apart from that, most things you do in sports are really good for your health. So I think there's a clear yes to this question, no doubt about that. Now, can sports organizations help people to become more active? That's a ridiculous question. What are we all doing? And I mean, if you also look at it conceptually, we've seen the schema by Dahlgren just a little earlier from Heidi, and this is an adaptation for physical activity. This is again the same in colors. If we look at physical activity behavior, we have some non-modifiable factors such as age, gender, climate, geography. We have personal factors, we have social environment, and physical environment. They all influence physical activity. And we've done this a few years ago. We've looked at the main factors, 3 groups of factors within each of these 3 domains. And I'm not going to go through them in detail, but if you look at sports, you see that sports can act on several of those. Definitely